My patients will die if Medicaid is cut. I'm very, very worried about my patients moving forward if they lose their access to insurance. If we're not able to bill insurance and cover our costs, all of these small hospitals will close, which will divert care to larger cities.
One thing that worries me specifically as a neurologist is that as Medicaid cuts of this size happen, rural hospitals like in Texas will just close. And so then the closest hospital to some of these folks may be, instead of 1 hour out, 2 hours out. We are burning through that 3-hour window to get treatment for stroke. And that can leave people with permanent deficits, paralysis, or just die.
There are time periods that really matter. When someone has a heart attack, we really have about an hour and a half to prevent life-threatening complications. So if you're closing a rural hospital and you're trying to divert care to larger cities, and those are the only hospitals available, that patient's not going to make it to a larger city before they have this complication. So that means all of our people in rural Louisiana and rural America are going to have worse health outcomes as these hospitals close and we're more reliant on like big city university care.
2 in 5 births in this country are covered by Medicaid. There's no way mathematically that a $600 billion cut to Medicaid won't cut prenatal care, birth, and postnatal care. In Texas, women can have 12 months of coverage with Medicaid after delivering. And if that goes away, I think we can see an increase in maternal mortality.
If we cut Medicaid, it will result in a higher healthcare cost because what we're cutting is access to chronic disease management, which then means if we're not preventing chronic diseases, we are allowing end-stage complications, which is really the cost, the hospitalization cost, the cost of transplant, major surgeries, dialysis. So the financial burden will be immense, and that's just if we're looking at money. If we're looking at the cost to human life, it will be devastating.